DocPlexis, in collaboration with TaskMed, brings to you MEDCAST, Insights into Healthcare, a KOL interaction series on diabetic dermopathy. Today, we have with us Dr. Subhankar Chowdhury, who is professor and head of Department of Endocrinology at IPGME&R and SSKM Hospital, Kolkata. He is secretary of the West Bengal chapter of RSSDI and immediate past president of Endocrine Society of India. He is also a founder patron of South Asian Federation of Endocrine Societies. Dr. Chaudhary, it's a pleasure having you here with us today.
Thank you.
The topic of today's discussion is diabetic dermopathy, a common cutaneous manifestation in diabetes. So we would first like to know, why are diabetics more prone to cutaneous manifestations?
Well, the reasons are actually multifarious. Part of that is because diabetics are more prone to getting infections, especially one of the barometers or reflectors of high glucose level is fungal infection in the skin and in the mucosa. So that is a skin manifestation, so which is related to high blood glucose itself. Then there are other issues, long-standing diabetes, because of different mechanisms, including decrease in blood supply, decrease or affection of nerve function, give rise to dryness of the skin. And then there are a few other sort of manifestations which are partly related to why diabetes has occurred, namely underlying insulin resistance. There are certain manifestations of insulin resistance which we can see in the skin. And then there are a few others actually which we do not understand exact mechanism of their origin. But nonetheless, skin manifestations are fairly common and they're fairly diverse. And except one or two, they are nothing absolutely specific for diabetes, but they tend to occur more often in someone who's got diabetes.
Thank you, Dr. Chaudhary. So having talked about cutaneous manifestation, do you feel like there are any other common skin manifestation of diabetes?
Right. As I was trying to mention that you could have the skin manifestations because of varying reasons. One would be the manifestations because of underlying insulin resistance, which is the common cause for the common type of diabetes that we see, that's type 2 diabetes. And because of insulin resistance, the body tries to compensate and produces more insulin in the body, at least in the initial stages. And these lead to two almost classic signs of insulin resistance in the skin. One is the pigmented, velvety thickening of the skin, most commonly seen at the back of the neck, around the neck, but also seen in the axilla, also seen in various other body folds, which is known as acanthosis nigricans. The other common manifestation of insulin resistance is skin tags, also technically called acrocordons. So these are related to the underlying cause of diabetes, let's say, that is insulin resistance. And then, as I've already mentioned, you could have various skin infections, of which I mentioned about fungal infections, most commonly because of candidal infection. But you could also, or you do also see increased prevalence of dermatophyte infections, commonly called ringworms. That's also common in diabetes. And then you are also predisposed, someone with diabetes, not you, someone with diabetes, especially uncontrolled glucose, is also predisposed to have the various cutaneous pyogenic infections, namely the boils. So all these are infective, and if we take them apart, and then we see a few other typical skin lesions. One is diabetic dermopathy. Another, which is thought to be almost a specific sign in diabetes, that is necrobiosis lipoidica diabeticorum. Those are typically seen over the shins. Even the diabetic dermopathy lesions are also typically seen on the shins. And then you can have a few others like granuloma annulare, you can have eruptive xanthoma, And very commonly, as also I have mentioned, which is not a specific skin lesion localized to any particular part of the body, but general dryness of the skin is also quite common, which goes by the technical name of xerosis. So these are broadly some of the skin lesions that we see in someone got diabetes.
Thank you, doctor. You have elaborated on most of the skin manifestations. If you could elaborate a little bit more upon what is diabetic dermopathy.
Diabetic dermopathy is seen fairly commonly. If you look for it, you will see, but unless you look on the legs, you will not find them because those are not an exposed part of the body typically. So you have to pull up the trouser, pull up the dress, the sari of the lady in order to see those lesions. But again, these are not lesions typically that patients complain about because they do not cause symptoms. They are not painful, they're not itchy, but they look a little bit odd, don't look so good unless someone is very conscious, wears maybe short dresses so the legs are exposed. They would possibly complain of them. And these are actually sort of brownish, somewhat atrophic skin lesions. Typically, they are small in size, but typically they're grouped together. And most commonly, they're seen on both the legs at the same time, and they are typically discrete lesions. They could be present in up to 40-50% of people with diabetes if you're looking for them. And again, like a few other skin conditions in diabetes, we do not know exactly what's the underlying mechanism. Once again, it could be because of deficient blood supply, deficient capillary supply, and also because skin is a common area of injury to the skin. So these are possibly the underlying mechanisms of diabetic dermopathy, and alteration of the collagen, the protein in the skin, by glycation because of high glucose levels possibly also contributes.
So, Dr. Chaudhary, we know that uncontrolled diabetes is one of the causes of diabetic dermopathy. Are there any other causes?
Not really. I mean, as I said, first of all, we must make it clear that we are not very sure as to what causes it. And in the sense that when we say uncontrolled diabetes, so if we have uh, 10 people with uncontrolled versus 10 people with controlled diabetes, it's not that those who have controlled diabetes do not have this lesion at all. They could also have, but of course, the chances are more in those who have got poorly controlled glucose levels. And the underlying mechanism, as I said, is possibly high glucose levels over a period of time, as it leads to various damage to the nerves, damage to the blood vessels, especially the small blood vessels supplying the skin. So those are thought to be the reason. And as I've mentioned also, changes in the collagen of the skin also contributes to this.
Thank you, doctor. So, moving on to the management of these skin manifestations. So, what are the different moisturizers for topical care in diabetic dermopathy?
I again would like to mention that there isn't a specific treatment for diabetic dermopathy, but what uh, we do observe quite commonly is a dry skin generally. And the dry skin is of concern not only because of the cosmetic reasons, but because especially dry skin leads to fissuring of the skin easily. And if you have fissured skin, there is more chance of bacteria entering from outside and leading to a deeper infection. And that is of special concern, especially in the feet. So dryness of the skin is one of the reasons for the development of a diabetic foot ulcer. So that's why we need to be concerned about the dryness of skin. Overall, of course, for a patient, the general cosmesis is also important. And you could use any of the cosmetics, any of the moisturizers that one otherwise has recourse to, but commonly used ones are the ones which I would prefer things that help to retain moisture in the skin. And usually or typically, if they are not on a creamy base, but components of these moisturizers could be glycerine, it could be aloe vera, It could even be an oily base, but I would like the oily part to be less and maybe the other components to be more in the preparations that I would be looking for, uh, especially in diabetes.
So I think, doctor, it will be very appropriate to say that skincare will play a very important role in it. So I would like to know your thoughts upon potential effects of glycerine, coconut oil, and aloe vera on this manifestations, as you have already mentioned. So if you could, showcase what your thoughts are on it.
Well, first of all, as I said, by keeping the skin moist, they keep the skin healthy, they prevent the undue breakage of the skin or fissuring of the skin, and so therefore prevent infections. And some of these, possibly aloe vera, are also claimed to have some sort of anti-inflammatory action, some mild antibacterial action. But most important is they help to retain, if you retain the moisture in the skin, you help to preserve its what shall I say, the strength of the skin as a barrier from external organisms. So overall, all of these components would contribute to maintaining the moisture in the skin and therefore preventing infections from entering.
Thank you, doctor. So overall, to sum it up, we are on the last question now. So if you could just highlight the importance of topical care and any closing thoughts which you have on it.
I think we often tend to ignore the skin, especially men with diabetes. Women generally are a little bit more careful about their skin, take better care of their skin. But once again, the skin care that women have interest in is possibly of the face. But
Correct.
we, as physicians, as dermatologists, are concerned in the health of the skin overall, and more actually in the health of the skin in the lower limbs, in the legs and the feet, for reasons that I've explained. So it's very important that whatever we do, uh, we use, of course, the standard treatment for the control of blood glucose and maybe control of high blood pressure, lipids, and all the standard treatment. But that part, some sort of topical treatment for the dryness of the skin is also important. It helps to prevent the water loss, the transepidermal water loss. And uh, overall, quite often it's found that rather than an individual agent, maybe a combination of agents could sometimes provide better skin care. And so I think we should have this also as part of the education that we give to our people with diabetes as to why we need to treat diabetes. And this also could form a part of our general knowledge capsule that we give to them, that take care of your skin and make sure the skin is also adequately hydrated and moisturized.
Thank you so much for joining and enlightening us on this important topic. Dr. Shubhankar, it was a pleasure having you here with us today. I'm sure the community will gain a lot of insights from this discussion.
Thank you very much. It was nice interacting with you.